Hello everyone, I'm Dr. Mustafa Mahmoud. Glycogen storage disease type 1 or von Gierke disease is a genetic metabolic disorder characterized by excessive accumulation of glycogen in liver, kidneys, and intestine. In this video, we will highlight the main concepts of glycogen storage disease type 1. Normally, in the cytoplasm of liver or kidney cells, glycogen breakdown occurs to form glucose 1 phosphate, then glucose 6 phosphate. Glucose 6 phosphate is transported into endoplasmic reticulum lumen by the enzyme glucose 6 phosphate translocase or G6PT, where glucose 6 phosphatase enzyme or G6 base releases phosphate group and produces glucose. In glycogen storage disease type 1, genetic mutations in glucose 6 phosphatase catalytic subunit gene, which is carried on chromosome 17, leads to glycogen storage disease type 1A, while genetic mutations in glucose 6 phosphate translocase enzyme gene, or SLC37A4, which is carried on chromosome 11, leads to glycogen storage disease type 1B. As a result of deficiency of either enzymes, which causes accumulation of glycogen and other metabolites in liver, kidney, and intestine. Clinical picture. The deficiency of conversion of glycogen to glucose in the liver leads to hypoglycemia and hypoglycemic seizures. With recurrent episodes, cognition may be impaired with failure to thrive and delayed puberty. The accumulation of glycogen in the liver leads to hepatomegaly and in kidneys leads to nephromegaly. The accumulation of glucose 6-phosphate can be a source for generation and accumulation of other metabolites like lactate, urate, and lipids in tissues. Patients with glycogen storage disease type 1B had low white blood cell count because glycogen 6-phosphate translocase enzyme is essential for white blood cells metabolism and function. Diagnosis is based on genetic testing for detection of glucose 6-phosphatase enzyme gene mutation in chromosome 17 for glycogen storage disease type 1A, and detection of glucose 6-phosphate translocase enzyme gene mutation in chromosome 11 for glycogen storage disease type 1B. Also, biopsy shows hepatocytes filled with glycogen, that is periodic acid sheaf positive with reduced activity of glucose 6-phosphatase enzyme. Finally, lab studies show hypoglycemia, lactic acidosis, hyperuricemia, high cholesterol and triglycerides, with neutropenia in glycogen storage disease type 1B. There is no specific treatment available for glycogen storage disease type 1. Symptomatic therapy is the mainstay of treatment through maintaining physiologic blood glucose levels with regular meals, snacks, and uncooked cornstarch, and avoiding fructose and galactose-rich food which cannot be metabolized in this disease. In addition, for treating dyslipidemia, hyperuricemia, and lactic acidosis, and granulocyte colony stimulating factor injections in cases of neutropenia. Currently, preclinical genetic studies using recombinant adeno-associated virus-mediated gene editing are ongoing to correct the pathogenic mutations for treatment of glycogen storage disease type 1, which may be available in the near future. By this slide, we reach to the end of our video today. Thank you and goodbye.